Well, it's the fat below the jawline, right? Don't look at mine. It's right here. You might call it double chin.
For some people, not even losing weight has worked to get rid of it. And it's not like you can do exercises to tone the area. So what can you do?
Well, Dr. Joel Schlessinger is here to explain. Good morning, doctor.
It's nice to have you here.
Good morning.
Yeah, good to see you.
Great to be here.
So this treatment really, it's an injectable, right? It's called Kybella. How does this work?
Well, Kybella is a new treatment. It's something that we've worked on actually since 2008. So we did the initial trials on this drug and marshaled it through the process of approval. And Kybella is a great new treatment for chin fat. Now, it's something that has been around for ages. It's something called sodium deoxycholic acid. So deoxycholic acid is part of bile, which is in our stomachs, and it dissolves fat. So that's what we do when we eat something. So they've taken this, they've made it so that it can be injected, and they've taken out one of the ingredients that initially was in it that didn't really make it great. So they made a product that is very simple, very easy, and in anywhere from 3 to 5 treatments can reduce the chin and make a nice profile.
Oh,
This is like magic.
The
It
difference,
is.
and we'll show you pictures here in a minute. You'll see the difference. It's noticeable, as you said, in as few as one treatment. Could you do liposuction on that area before Kybella was approved, or what were the options?
Yes, absolutely. So before we had Kybella, we had liposuction, but liposuction has a little bit of downtime. So you have to wear a chin strap for 3 days. People don't exactly like the thought of having something entering them. With Kybella, it's completely non-invasive. It's about 10 little injections, and you're done. You go on your way.
So you can go back to work?
Well, there is a little bit of swelling. I don't,
Well,
you know,
yeah.
you can go back to work if you don't mind a little bit of
But
swelling.
you're not taking 3 days of vacation
absolutely
to stay
not.
home and heal.
No. That's the beauty about it. So it's very simple. You can go on with your life. You know, you might wear a little turtleneck or a scarf, but that's about it. It's very simple. And then in about 2 months, you can get your second treatment. Usually people have anywhere from 2 to 5 treatments. And if you have a small chin, it's very simple. You may even need 2 to 3 treatments.
Yeah, that's what I was going to ask you, because it's an injectable. And what are you doing right here as you're marking
So
out?
that, you mark the area, and when you mark the area, you see where exactly the areas for need are. And so what I'm doing is I'm taking off that little grid, and then I inject it into each little area. And as you can see, it's very simple. It's done in about 3 to 5 minutes.
You know what else I noticed? She's not wincing in pain.
Oh, no.
It looks, she's just laying there like nothing's happening.
No, we put on a little bit of numbing beforehand, and it's really very simple. You can do it in about a morning, easy morning. You can have it done, and she can go on to work if she wants to. Now there is that swelling you have to worry about, and so some people take off that day. But honestly, you don't have to if you don't mind going around with a little bit of swelling.
Well, and this time of year, we've got scarves on anyway.
Absolutely, this
Yeah.
is the perfect time of the year
Yeah.
for it.
So as you go through this procedure right here, how long does that take? Each treatment?
Oh, each treatment takes about 5 to 10 minutes.
Yeah.
Oh,
And
my.
Is it.
that's not long. And is there a certain time of the year? I know we're in the winter time here, and New Year's resolutions. Everybody's thinking about that. But is there a certain time of the year that's better than others?
Well, I
tend
tend to think that the winter time is good because you can wear a scarf or a turtleneck, and it's very simple, and you can go about. And most people will notice it on themselves, the swelling, but most other people don't notice. It's not that bad that they notice it. So I wouldn't do it right before I was going to a major event, like if you're having a wedding or
Right.
a big speaking engagement. You can see her pictures
Let's
there.
do
They're
this.
really impressive. So this is a person who had a very small chin, but afterwards it really thinned her chin down, and you can see that she has just a much nicer profile. That's after 2 treatments. So it didn't really take that much to get her to the point where she was seeing a nicer profile. And I think that that's something that is really nice, both for women and men. This is one of those procedures that has gotten a lot of men interested in coming in and improving
You can
themselves.
see that. Here's another before and after.
Yes,
That's
you can see how
remarkable.
dramatic. Now that is after 2 treatments also.
Wow.
So a very simple treatment, and some people who wouldn't have been a candidate for liposuction because frankly there wasn't enough fat there are a great candidate for Kybella.
What are your patients saying after seeing these before and afters?
Oh my
And-
goodness, life-changing. Life-changing. I mean, it is really something that people who have wanted to do something about their chin and neck area for ages can finally do something, and it is so simple. I cannot tell you what a difference it is between going through liposuction, which arguably liposuction is great, tumescent especially, but it is not the same as this. I will tell you that.
I can imagine like your grandchild saying, hey, let's take a picture. I want to put it on Facebook. And before you would have said, No, I don't. I'd rather not. And now you have the confidence to say, yeah, let's do it. You know, you're confident that no matter the angle, you're going to look great.
Well, the other thing is that we're in the selfie era. This is the era
Don't we
of
know
having
it?
people like, how do I do this?
And they're terrible angles too, these selfies.
Nothing turns out right in a selfie. So I think that is perhaps the most perfect marriage of Kybella and the selfie. It's new, it's here, it's great, it's simple, it's something that we can access and really do over a day or even a weekend.
I think it's really neat and a feather in your cap to have been part of the trials, that you're not just offering it now, that it's approved and available across the country, but that you were there sort of introducing it and trying it out, that they thought enough of your center
Yeah,
Oh,
to ask you to
absolutely.
be involved.
And that you're also, go ahead, I'm sorry, doctor.
Well, we've actually followed people for 5+ years after it, so we know how safe it is and effective.
And our viewers have seen this on the screen for about 20 seconds now, so that's not new to them, but I just want to mention that the special offer, save up to $100 on Kybella and receive a lovely skin gift card as well.
That's wonderful. So get in and that initial consultation to say, yes, you're an excellent candidate for it, and these are the results you can expect to see. So let's show you the number to call. It's 334-7546, and then online, lovelyskin.com, where you can learn about Kybella and a number of other awesome services.
Yes, so it's true. There's something that dissolves fat.
There is.
At least right here.
Yeah.
Oh,
Right?
yes.
I want to come back when we can use it in other parts of the body too.
Well,
I
you know,
feel like
there's-
that's the future.
There's a lot of work being done on that. We've actually done some clinical trials on another product that may be useful for the abdomen. But Kybella's here, it's available, and by the way, consultation is free.
Oh, great.
Yeah,
so-
Great. I know.
Doctor.
Aren't you doing like you're thinking? I'm thinking. I'm not saying anything about you.
What are you saying here?
Thank you, Dr.
Who knows, maybe we'll
Schlessinger.
do it on air next.
Yes, oh, that'd be a great idea, Mayor. That'd be great,
Thank
Mayor.
you for coming in. It's
Thanks,
great
Doctor.
to see
Yes,
you.
in the morning.